I'm Gloria Strode, and welcome to Straightforward. Today we are going to continue to educate you on some health matters. Joining me today is our neighborhood nephrologist, Dr. Raj Alappan, our excellent team from Columbus Vascular Center, Dr. Stevick, and Laura Pear, who is the person that makes everything roll over at that center. Welcome. Thank you so much for coming.
Thank you for having us.
Okay, Dr. Alappan, you are good at getting people together and doing great things for the community. Explain to our audience how you and all of the great people over at the Columbus Vascular Center came together and brought this wonderful resource to the community.
Gloria, thanks for having us on this program. It's always a wonderful opportunity to be with you, and you're such a wonderful personality to be with, and also to do this to the public, to give them a kind of a first-hand knowledge of what exactly we all do in this section of the health matters. Basically, if you really look at it, we have a large population in Columbus. Generally, if you look at it, they're all retired populations.
Yes.
And they deal with many of the medical illnesses which comes with the age. And one of the things which we always have is, as you know, I'm being a nephrologist. I talk about kidney failure, but patients have got heart problems. They also have things related to stroke, and also problems with the legs, with what we call vascular insufficiency, or blood supply to the legs is not enough, and they start having complications. If you look at all these things, one thing is common is the blood vessel.
Right.
The blood vessel takes all the things to the different parts of the body.
Right.
To the brain, to the heart, to the kidneys, to the legs, everywhere. So that is what is called as vascular system.
All right.
Now, when that is affected, you get all the complications, and one of the complications which happens in the kidneys is where I come with, is as being as a kidney doctor or a nephrologist, we take care of kidney failure. Now, in this particular segment, what we are dealing with is the vascular system, or the blood vessel system. And you can talk a lot about that, but to go down to what we do, we have this vascular center. And this center actually, it takes care of everything which is related to the blood vessel system.
So our veins and the arteries.
True.
And
True. Mostly when you talk about vascular, we talk about the arterial system.
Okay.
That is what the blood from the heart goes to different parts of the body. And the venous system is when the blood gets back into the heart.
Okay.
So there's a both-way traffic kind of thing of the blood.
Two-way traffic.
Two-way traffic. That's what we talk about, the vascular system. So the vascular center which we have, we needed this because it's the best way to give patient what they need without going through the hassle of doing certain things, like, you know, most of the time they need to get to the hospital, admission, stay there. So most of these things have now become like a day procedure.
Oh, exactly.
So you just walk in, get the procedure, you come out.
Right.
That's what vascular center is all about.
And that is why you wanted this collaboration, because it will keep people from having to go through a whole day of paperwork and all of that pre-stuff.
Absolutely.
Right.
It started off with our dialysis patients. They have actually in their arm what we put an AV fistula or an AV graft, two things which we use to stick that to get the blood out to clean and send it back. That is what is called the AV graft and AV fistula. Now, these always undergo complications. So to get this started, we wanted a vascular center which would do this as a day procedure, send them, get them done, and get them back to the dialysis unit the same day or next morning. If not, they have to go through the hospital stay, operating room, then surgery, then stay there, come back.
So it shortens that process, and it makes it convenient for the patient and for the family.
Absolutely.
Because I know Laura was there, and I really want to thank you publicly for you and the team and what you did with my dad at 90 when he started on dialysis. We came to the center, and you all put in his whatever, what was that?
That was actually a AV graft.
Right. And then when it needed flushing out, we came back to you again, and it had to be flushed out. And you all were very personal and very patient. And that's what I was saying to you in a conversation before. Going to the big facility is not always good for families. Like for us, we had someone almost 100 years old who had never really been sick. And so you all were able to give that attention and that personal touch.
I think that's one of the things that Dr. Alappan and Dr. Stevick and I are most proud of is our nurse to patient ratio there is pretty much 2 to 1. We have 2 patients to every 1 nurse, and that's pretty rare these days in any hospital environment. It's something that I think is unique about an outpatient setting, is that more one-on-one care environment where we can spend the time to talk to the families and answer their questions and feel like we really have thoroughly done a good job making sure the family understands, you know, the care before the procedure, during the procedure, and after the procedure, and make sure that they leave with no questions.
Right, and no question is a dumb question.
No question is a dumb question.
No, and then you have the patience and then just the where you're approachable, whereas sometimes when the institution is so large, people don't have time because the pace is so fast.
And you don't know who to talk to. There's so many different people wearing different color scrubs that have different functions in the hospital, and where we work, we pretty much do everything. We order the supplies, we stock the supplies, we do the linen, we clean the beds, and we're all, pretty much clinical personnel. We're all nurses and radiology technicians, and so pretty much if you stop anybody, they're going to be able to answer your question.
Right, so this is almost like a one-shop stop.
Yeah, it really is.
We have actually evolved from taking care of only dialysis patients. Now it has gone a little bit even further down to take care of other things. People who got blood supply which is compromised to the legs, they can get into what is called ischemia or gangrene of the feet. So these people, our vascular center can go in and take care of that. So that is the main thing, to intervene before something is too late to happen.
Exactly.
So in line with that, we actually, a group of doctors, they partnered along with the surgeons, and then with an external group called American Vascular group, we did this center. Now the center has really grown over a period of time, and we are able to service quite a large population of Columbus community.
Okay, well that's good. So another excellent resource. What we're going to do right now, we're going to go to our sponsors, and we'll be right back. We'll be right back after word from some of our sponsors. Straightforward is brought to you by Chalk by Quincy, introduces Excellence Redefined, timepieces of the finest technology, luxury, and class with tons of style at chalklifestyle.com. Renal Associates, LLC, a team of physicians dedicated to excellent kidney care with 5 convenient locations to serve you. Stark Avenue, Columbus, Bradley Park, Columbus, Lafayette Parkway, LaGrange, East Burkhalter Avenue, Buena Vista, and Springs Street in Warm Springs. Thai Cuisine, the area's only authentic Thai restaurant. Open for lunch and dinner, Monday through Saturday, located in the Village Green Shopping Center on the 280 bypass in Phoenix City.
Walmart's reason for supporting Thurgood Marshall College Fund is simple. We like to win. And we have been given a lot of exposure to some incredible talent. And we also believe that it's a part of our responsibility to the community to give back. This is a great opportunity to do both. It's been a wonderful experience for us through the years. We've appreciated our partnership. We believe in return on investment, and we have definitely had a remarkable return.
And welcome back to Straightforward. I'm continuing my conversation with Dr. Stevick and the wonderful Laura Pear from the Columbus Vascular Center. And they are doing some awesome things over there to help families out so you won't have to go to the larger facilities, go through all of the red tape. So share with our audience some of the procedures that you all do there, because we want to make sure that we can redirect some traffic over there and folks won't have to go through a 1-2 day process just trying to get to the procedure. So Dr. Steven?
Sure. Well, as Dr. Alappan said, we started with dialysis access procedures. Certainly that has been a wonderful thing to that population who really have trouble getting in and out of the hospital. To be able to have x-ray studies of their access just gives them a great opportunity to do it very easily as an outpatient procedure in a small setting. Other than that, we also evaluate patients with peripheral arterial disease and with venous disease we
So is that like where they have sores on their legs and they don't heal very well? Do you all work with that? Because I know there's wound care, but then there's you need to be assessed first. Is that what you would do?
Wound care evaluates all types of wounds and tries to differentiate for the etiology of those wounds. And certainly there are wounds that are due to arterial insufficiency. There are,
so for our lay people, all of you brilliant friends of mine, arterial insufficiencies. What does that mean in layman's terms?
Right, sure. So basically, your blood vessels, your arteries carry blood from your heart to your toes. If you have a blockage due to cholesterol buildup, plaque buildup,
very good,
then that can limit the blood flow that is getting out to the end of the line, basically. And so if the end of the line is your brain, it can lead to a stroke. If the end of the line is your kidney, it can lead to kidney failure. If the end of the line is your toes, you tend to get sores on your feet.
And you might end up getting your foot removed.
That's certainly
right. And that's what I like when we educate people on this show. I want to give it to them real plain so they can say, I learned that on Straightforward. So I know you all are so brilliant and you talk at that level, but when I ask you, I just want you to. So it means that the gas is not getting to where it needs to get all the time.
That's right.
All right.
And that the concern with peripheral arterial disease is the end result can be loss of limb due to gangrene or infection sets in, something. And so obviously that's a very important thing for patients and for us. We tend to, we look at arterial disease and we try to manage that aggressively in their evaluation and management to avoid limb loss if possible.
Because that's a life-changing event.
Because that's a life-changing event.
Yes, it is.
Right.
Wow. Right. And so, Laura, you've been there, and of course, I've seen you over the years, and we've had a baby there, and still working, you know, taking care of people. What is it that you can tell families? Because we're very fearful. The first time we came, my dad had so much anxiety. We had so much anxiety. But when you get there, it's so personal. Even the building is not so overwhelming. Of course, you have all the state-of-the-art equipment, but you're just not as overwhelmed as you would be, say, if you went to an Emory or someplace like that.
Right. One of the things I love about working there is that we just usually have one doctor in the building. So instead of at a hospital environment where the nurse is trying to call a doctor and always trying to get on the phone with a doctor who may not be present in the building, I just walk over to the hallway to Dr. Stevick's office and ask him a question. So if the family has a question,
accessible.
He's very accessible.
Oh, we don't have to put you on GPS and find you.
No, we don't. We don't have to page him or call him. I just walk on down to the office and ask him to come out and help us with whatever we need help with or whatever questions we can't answer. And I wanted to touch back on the peripheral arterial disease. So some of the questions we like to ask patients and their families when they're in there for their first evaluation are, do you have the 4 major risk factors for peripheral arterial disease? That's smoking, high cholesterol, diabetes, and hyperlipidemia. No, I already touched that one. High cholesterol was hypertension. That's a huge one. I can't believe that I forgot that one. So those are the 4 main risk factors.
So say those again.
Smoking, diabetes, high cholesterol, high blood pressure.
And high blood pressure. And we know we live in the Bible Belt, and we like fried chicken on Sundays, and we want the peach cobbler because it's peach time now, and we want sweet tea. But we need to kind of get that under control so we won't run into those, could run into those type of issues.
And some things your family member might tell you that you know, will maybe make you think, hey, you know, I learned that on the Gloria Strode show, and I may need to make an appointment with Columbus Vascular Center. Is your family member, when they're walking, do they complain of cramping pain in their legs? And that usually it's a cramping pain that's so significant that they actually have to stop, and they might have to like rub their calf and wait for the blood flow to kind of return to that muscle so they can get moving again.
So is that what we call on the street a Charlie horse?
Yes. Sometimes.
Sometimes we're calling it what it really isn't. Sometimes.
If it's related to exercise, it's an exercise-induced calf pain, cramp. Not the ones that you get when you wake up in the middle of the night with a Charlie horse. That could be something a little bit different. That may actually be more of a sign of venous disease than arterial disease.
All right, see, we need to know that because we live in the South, you know that, and of course I'm going to find out where you are in the next segment. But we have all of these, you know, home solutions, wives' tales, and sometimes that's not good for us. I do know people with high blood pressure that says, well, I can drink some vinegar and not take medicine. No, you can't. You know, and so you're working against all of those myths and wives' tales as well. So where are you all located?
We are, if you know where St. Francis Hospital is, what I like to tell people is we're across the street from St. Francis Hospital in the same shopping center as Cool Smiles and Starbucks, and there used to be the yogurt shop over there. So we're in that same little shopping center. And if you come to the outside of the building, it doesn't look like there's much going on from the outside, but once you go in, I think a common response from people is, oh my gosh, this place is so big on the inside. I had no idea you had all this back here. It's a little surgery center, and that's truly what we are.
And it's convenient.
Very convenient.
I mean, we're saying Manchester Expressway, city center, easy to get an appointment, to get in and out, not a 3 or 4 day process. You can just get right in and get that personal attention, where the doctor is across the hall, and we don't have to track him down on his boat somewhere fishing.
No, we don't. I think a common thing I hear patients say is, oh my gosh, the doctor spent so much time with me. Usually, sometimes the doctor, you know, they're on a time crunch when they're, you know, in the hospital. They got a lot of patients to round on. He just has our patients to see in the center, so he has a little bit more time to spend with them and educate them and answer their questions.
One-on-one. Okay, well, what we're going to do is take our final break, go to our sponsors, and we'll be right back. Okay, we'll be right back after word from some of our sponsors. Straightforward is brought to you by Warrior Outreach. Contact Command Sergeant Major Retired Sam Rhodes or Kathy Rhodes. Freedom Printing for all of your designer printing needs. Gunboat Plaza, Suite 18. Zeal in Uptown Columbus, where you can enjoy an intimate dinner atmosphere, and every entree is chef-inspired with passion. Dinner is served Monday through Saturday, 5 p.m. to 10 p.m. Howard Johnson Hotel, 1011 Veterans Parkway, Columbus. For an international dinner experience you will never forget. Zeal in Uptown Columbus. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided. A touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road. Trusted by generations. Best Care, transforming minds and bodies, leading the way in the latest techniques of medical weight loss and wellness. Certified in family medicine and bariatrics, Dr. Blunt is ready to assist in the transformation of your mind and body. Call today, 706-221-6477, or visit bestcarecolumbus.com. East Alabama Endocrinology, educating and caring for those living with diabetes in Alabama and Georgia. 1400 Bradley Lake Boulevard, 3320 Skyway Drive, Suite 602, Opelika. Take charge of diabetes and live your best life.
History is important because it shows where you're coming from and where you're going. Type 2 diabetes is something that runs in my family, which means I'm at risk. In fact, 1 in 3 American adults are at risk for developing type 2 diabetes. And knowing this, if I do nothing, that family history becomes my family's future. And my family is too important to me for that. Take the risk factor assessment today at AskScreenKnow.com.
And welcome back to Straightforward. I'm continuing my awesome conversation with my great friends from the Columbus Vascular Center. And today they have enlightened us on some things we need to be looking at, because we don't want to have to visit them if we're at risk of having a limb or something removed. We want to make sure we stay on top of our health. But we were chatting during the break, and I learned that you were so blessed to marry a Columbus girl.
I did.
How did you get so lucky?
Well, we went to college together.
Okay.
Yeah, this will be our 30th anniversary this year.
Wow,
So.
good for her. Good for you. You did good.
I did good.
When you marry a Columbus girl, you know you marry up. And so you attended Valdosta State?
No, I grew up in Valdosta.
You're from Valdosta. Okay.
I attended Mercer.
The Mercer University.
Mercer University in
Yeah.
Macon, and then I went to med school in Augusta.
Okay, the Medical College of
Medical
Georgia.
College of
Very
Georgia.
good schools
It's
in
changed
Georgia.
names a few times since then, but
Yeah.
that's the way I remember it.
Okay.
And then I did my surgery training in Macon, back in Macon.
Okay, and so you got so lucky and got this Columbus girl, and
Columbus
she
girl.
encouraged you to bring all of your brilliance and skills to our community and take care of our people.
Okay.
And he said, okay. And so you're celebrating 30 years of marriage.
30 years.
So you
this
have
year.
children.
I have 4 children. They are, well, my son just graduated from pharmacy school, actually, in
Really?
Athens, and I had another son who just graduated from college in North Georgia College in Dahlonega, and another son who just graduated high school. So I've done 3 graduations in the past month, but and
So
my
you
daughter.
have no money. You got to hurry up and get back to the office. So you have 3 boys and a girl.
3 boys and a baby girl.
Oh,
yeah,
you will
she's-
never have money. You're going to work all the time, and she is the baby.
She is the baby.
Oh, daddy's girl. Well, I'm happy that you brought your brilliance and your skills here to take care of our citizens. And again, the center took care of my dad. And people that know me know I don't blow smoke. So if I say it's good, it's good. I don't do smoke and mirrors. And so I just think you all do a fantastic job. I like the one-on-one. I like where you come in. It's very personal. It's not a very long wait. It's easily, it's access. It's easy access. So Daddy was on a walker, but he could get in and out. You can pull right up to the door. I mean, it's just so many great things, and that's why I wanted you all to come today so we could get that information out to the public. Because sometimes people are just so busy, they do what's comfortable, and we have to train them to do what's best. So you just make every woman jealous. You just had a baby. What did we have?
I had a boy, so that's my second boy. I have a 3.5-year-old and now a 4-month-old.
And you're working over at the Columbus Vascular Center, taking care of all of these people and 2 little boys.
2 little boys.
And that's why you look like that.
I do milk feedings at night and patient care during the day.
Really?
Yes.
My goodness. And so how old is the baby now?
He's about 4.5 months old. So we're starting to smile, we're cutting teeth, and we're waking up a lot. And
you're still getting up and
I'm
being
still
over
getting
there
up
taking
and-
care of the patients and the families, because our family was high maintenance. And so you are from Columbus.
I am from
And you
Columbus.
are a Hardaway, Pacelli.
Pacelli graduate.
Pacelli, is it your wife?
My wife graduated.
Your wife went to Hardaway.
Yes.
Okay, and so you're Pacelli, and of course that's still around, and
Yes.
people are graduating. And have you run into people that you knew that now say yes ma'am to you? You're not that old yet.
yeah, I do get yes ma'am now, and that's different for me. But this is the South.
When you've
so
been one of the young people and people start saying yes ma'am, then you realize you are transitioning to one of the older people.
Yes.
Yeah. So what should our viewers do if they want to come? Do they have to have a referral from their primary care physician or from a nephrologist, or how does that work? They just can't walk in without a referral. How does that work?
That depends usually on insurance. So if they have an insurance that's like an HMO, where they have to, go with a health maintenance organization where they have one primary physician that they see that sends them out to different, specialties, then they do have to have a referral. But if they have a PPO insurance, and you can just, the easy way to tell is by looking at your card, and you can usually see if it says HMO or PPO.
Okay.
And that's a good way to tell whether you need an appointment through a referring doctor or not.
So HMO, they probably need a referral.
Yes.
PPO,
They can just call our office and
come
say,
in.
you say, I'm having swelling, is that something you can help us with? And we'll say, absolutely, we would definitely love to take a look at you. And we usually get you in. Sometimes we can do same day. Actually, a lot of times
Really?
we like to do same day.
Wow.
Yeah, Dr. Stevick's really open. Sometimes we'll get a phone call at 4:30, and we're open, by the way, Monday through Thursday from 7 a.m. to 5 p.m. And then on Friday, we're open from 8 a.m. to noon. On Friday, we just do scheduling.
Right.
So you can call us during any of those times, and somebody will answer the phone and get your family
So
member
it's
or
mostly
yourself.
admin stuff on Friday.
On Friday, mostly admin
Okay.
stuff.
Well, that's
but
important.
Monday through Thursday, we see patients and do procedures, and we like to be as, like you said, accessible and convenient as possible, and try to get people in and out as quickly as possible.
Okay. So you're from the South, and that's a good thing. I'm glad you know that, because then you understand the Bible Belt. No, a lot of people don't understand that. So in the South, we show love with food.
Okay.
The big Sunday dinners. I mean, that's just
I'm all
a part.
about food.
Me too. But that's a part of our Southern culture.
Sure.
And so what are we saying to the people when they have to come in and you have to have that talk? You know, when we see that they might have diabetes or other things and some things might not be going in the right direction, how are you strong enough as a Southerner to just kind of say, maybe you can't have that peach cobbler this Sunday?
I'm not going to tell people they can't have peach cobbler.
But not every Sunday.
But you can't eat a big bowl of it.
Okay.
And expect your sugar to maintain normal.
Right.
You really do have to maintain normal blood sugar levels and do what you can for your cholesterol. Certainly avoid smoking. Exercise is really a good thing. Walking every day. You don't have to go out and do marathons, but just some exercise.
Just even for a few minutes, if you have the
Walking on your lunch break for 30 minutes.
That will help.
That will help.
Yeah.
That will help.
And so we don't have to just go to, you know, the new craze now. Of course, some people are going to the gym for social. You know, they got all the cute outfits, and I can't see any results on their part. Of course, I'm not even going at all. But what you're saying is we really have to put in some physical activity as well. You all are there to help us if
That's
we
right.
get in trouble, but you want us to kind of do our part.
Right.
He
Yeah.
can't do all the work for you.
Exactly.
Well, there has to be the modification of your risk factors just to lower your risk so that you don't end up losing a limb or you know, developing sores that get infected.
Right, that you can't take care of. So again, tell us where you're located. And
We are located on Manchester Expressway and Woodruff Road in the same shopping center as Cool Smiles across from St. Francis Hospital.
and what's your phone number?
706-221-8999.
Well, thank you so much. You have to
Thank
come
you
back
for having
again.
us.
We want to keep educating our community. That's so important. And thank you so much.
Thank you.
All right. This has been Straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.